Hi, I'm Dr. Shobha Badiger. I'm a senior consultant pediatric hemato-oncology and bone marrow transplantation in Narayana Health, Bangalore. In this video, I'll be talking about donor selection. Now, when we talk about donor, I mean a healthy person who is giving his or her stem cells, donating his or her stem cells to a patient. Now, if the patient himself is the donor, then it is an autologous transplant. If another person is a donor, then it is an allogenic transplant. Irrespective of who the donor is, especially in allogenic transplantation, we need to select outside donors. That is not the patient, but a healthy donor. Now, this healthy donor, how do we select him or her? So, we do what is called HLA typing. HLA typing is a kind of test which can be either a blood test or a test taken from the inner side of the cheek, which is called buccal swab. Now, in these two tests, one of these two tests will be done. A series of antigens will be detected in the DNA. This is called HLA typing test, and the result takes anywhere between 7 days to 15 days. Over here, we will try to see how much of the donor's antigens matches with the patient's antigens. And depending on the degree of match, we classify it as fully matched HLA donor or haplo-matched HLA donor. If it is a fully matched HLA donor, this donor can be either related to the patient or unrelated to the patient. So we have again fully matched donor, and again in fully matched donor we have a matched sibling donor or matched related donor who is not a sibling but is related to the patient by blood, and matched unrelated donor, that is a stem cell donor who is not related by blood to the patient. If it is a haplo donor, it means that the HLA typing is 50% or more matched with the patient but less than 100%. We have done a lot of transplantation with haplo donors as well. Now, once the donor is selected, we need to make sure that the donor is healthy enough to donate the stem cells. When we talk about health, we are not talking about conditions, chronic conditions like hypertension, diabetes. So the donor can have all of these. What they should not have are viral infections like HIV, hepatitis C, HBsAg, malaria, toxoplasma. These infections should not be there in the donor because they can get transmitted to the recipient through the stem cell infusions. So we do a lot of tests on the donor, routine tests on the donor, and as well as these viral parameters. And if they have any concerning health conditions which may not affect donation of the stem cells and may not affect the recipient, but we are concerned about the donor's health, and therefore certain tests specific to the donor may also be done. Before the test also the donor is counseled, and after the test the donor is counseled again so that they know what they are doing. And the first thing that we tell in counseling is that it is a very safe procedure for the donor. We have not seen any donor who has gone into any kind of short-term, immediate or long-term complication because of stem cell donation. So it is an extremely safe procedure. So once this counseling is done, we also teach them how the procedure is done, which I'm going to talk in this video. So once we have cleared and selected the donor, we select a particular date to collect the stem cells. 3 days before or 4 days before the date of collection, we give an injection called growth factor, that is or GCSF, which is a small injection which is given just like insulin under the skin. Now this is given once a day or twice a day for 3 to 4 days. The purpose of this injection is to increase the number of stem cells that are being produced in the body, so that the surplus of stem cells can be collected and donated to the recipient. On the 4th or 5th day, we actually do the process of stem cell collection. So there are two different processes of stem cell collection. One is through bone marrow harvest, and the other one is called peripheral stem cell collection. In the bone marrow harvest, the donor has to undergo general anesthesia so that they don't feel the pain of collection. Why pain? Because we take very thin needles and we prick it in the hip bone behind, and we do the pricking many times so that we can collect adequate volume of blood, marrow, which has stem cells. Now that pricking is very simple but can be painful. To avoid perception of this pain, general anesthesia is given, and it is an extremely safe procedure. It is the same general anesthesia that is given for any other surgery. There is no cutting or suturing involved in this process. Once this process is over, the donor comes out of general anesthesia and can be discharged. Generally, we discharge a person who's undergone general anesthesia, we discharge the next day just to make sure that everything is well with the donor. The donor during this time, depending on how much volume we collect, what is their initial hemoglobin and their weight, we may have to give blood transfusion in the form of packed red cells to the donor. Once they are discharged, there won't be any medications, and most of the times we don't need to see the donor again unless the donor wants us to see. There will not be any pain after this procedure, short term or long term. Of course, because we have pricked, when the person touches that area, there may be mild tenderness for a week or so. It is just like you having a needle prick, and when you touch that area, you may perceive pain for some days, after which it vanishes. It's exactly like that. We have not seen any of the long-term complications, so this process is extremely safe. Now, how is peripheral blood stem cell done? We give 4 days of GCSF. On the 5th day, we do the peripheral blood stem cells by putting a needle in one hand, through which the blood is drawn into a tube, and the tubing goes into a machine called apheresis machine, and this machine collects only the stem cells. All the other cells of the blood are given back to the donor through another line which is on the other hand. So essentially we're taking only stem cells, all other red blood cells, white blood cells, platelets are given back to the donor. So this process takes around 2 to 3 hours, during which time the donor has to lie down or sit, keeping both the limbs immobile. If they are very young children, wherein putting these lines are very difficult, we may put what is called femoral line, which will be in the leg. For this, we may have to sedate a child for a short time, like maybe 5 to 10 minutes, put the line and finish the procedure. So this procedure, as I said, will take again around 2 to 3 hours. So this is all with the donor. Once they have donated, we take the bag of stem cells that is collected, test the bag for what is the amount of stem cells that we have collected, and if it is adequate, we don't do a second collection. If it is not adequate, we may end up doing a second collection the next day, in which case they'll be getting one more injection of GCSF. So once the collection is done, we thank the donor for this life-saving procedure, and the donor can lead a healthy life later on. They won't need any medications, they won't need any painkillers, and most of the time stem cells is donated once in a lifetime. Thank you.